Hello, everyone. We are back. I'm super excited. We are on part three of our interview with Rob, who owns OrthoFlex at Howard Beach and uh, outpatient clinic that he's had for decade plus. I have him back on because we started talking about, we started with neck, then we did back, and now we are back to down to our legs, lower extremities. So I'm gonna get him on right away so you guys can get some information from him. He's given amazing tips and pointers on some of the things that you might be feeling or having issues with at home that you don't know what to do about. So again, it's going to be one of those interviews that you're going to learn a lot. As you're aging, a lot of these issues come up, or if you're in sports and stuff, a lot of these issues come up. So let me get Rob on and then we can get started.
How are you, Fareen?
Good. How are you, Rob? How's everything?
Doing well, thank you.
Awesome. Okay, we have worked our way down. We did the neck, the back, and now we're doing the lower extremities.
Correct.
So Rob, if you can, same way you have done before, if you can just give us some of the basic things or issues that you see a lot of right now, in your outpatient clinic, and you can get us started on that, and then we can take it from there.
Well, most common stuff that I see with the hip and the knee would be osteoarthritis. Also, bursitis with the hip is a very common injury. It's an overuse injury and inflammation of the bursa sac of your hip joint. I also see meniscal tears, which are very, very common. And foot and ankle stuff that you normally see would be usually like sprains, some arthritic conditions, but some foot problems would be like a fractured metatarsal where people are in a cam boot for a few weeks and stuff like that.
Yeah, we see a lot of that, people walking around with like boots, depending on the weather also, right? All of a sudden it snows or there's black ice and then
Unfortunately, it happens more frequently than you think.
Yeah. Or with sports. A lot of people with sports injury and stuff also.
You see a lot of sprained ankles with sports injuries. Most common things that you see, though, are ACL injuries. Some require surgery, some don't. And there's protocols that you got to follow with that as well.
So, Rob, since we talked about sports injury, I'm going to just jump into it. I know I see a lot of people who have sports injuries and then they kind of just go, they get the surgery done and stuff, and maybe like a little bit of PT afterwards, and then that's it. And then they never really do anything else around it. And my biggest concern has always been that people need to like really take care of the problem. Like, what is it that you would recommend for people who have had that kind of injury? Like, what kind of home exercise program, or how long do you think those exercises needs to last, or like is there needs to be then a regular regimen because now they have a site that's have had a previous injury?
Well, that is true. Unfortunately, like these ACL injuries, we only see them for like 2 to 3 months, and then the insurance is getting cut off. So you give our patients, a really good home exercise program, but then you really can't. There's like specific weeks for different with the protocol that they have to go from running drills to high impact jumping drills, things like that. That unfortunately we can't keep them on long enough to bring them to that functional level that they need to return to sport. So you just pray to God, you instill in them what they need to do. And then once you discharge them, you kind of ask them to call you if they want, or stop in the office just to kind of follow up to see where they're at, to kind of guide them on the right path, whether or not they're working with a trainer or they're in the gym by themselves, or they're going back to their sport and gradually try to get back into it.
Right. So this is something that once you have injured something, you need to keep an eye on it constantly. You can't just be like, oh, I had it, like 3 months ago and I fixed it at that time and now I'm good to go. No, you need to keep, especially if you're back in the sports, in that sport again, you really need to keep an eye on it because it's something that you need to
Yeah,
keep.
you can definitely re-injure yourself if you're not rehabbed correctly.
Exactly. So that guys, that is so, I know, because people who are athletes, they usually want to just go back into what they were doing anyways. They don't want to take time off. So
It's good to be young.
that's true.
Yes.
Okay, so let's talk about some of the hip problems. Especially a lot of people complain of sciatica pain.
True. So sciatica could be stem from is it a true sciatica coming from the muscle in your buttock where the sciatic nerve runs through? Could it be a a hip bursitis or a knee problem on the opposite side where you're kind of leaning to one side too much. So for instance, if you have like left knee arthritis or a left hip bursitis, you're weight bearing more in the right lower extremity. So therefore, what you commonly see is they may be coming in for a left knee or a left hip, but you're also treating sciatic symptoms, which is the secondary diagnosis, secondary to compensation of weight bearing more on that right leg than their left. So it's a common thing. So you have to address all issues, and that can become complicated at times.
Right, right. I know sciatica pain can be like so debilitating. I've had people like come, and there are a couple of really easy stretches actually they can start, at least they can start with, that can relieve the pain as far as sciatica is concerned. But you're right that overuse or misuse of the other side can also cause it. So this again, going back to the basics, like if you have an issue and you don't take care of it properly, it's not just that one knee that's going to hurt. You can then transfer it to the other side or your back. Pain can travel up, down to the other side, because now, like you said,
Absolutely.
yeah, because you're not using the rest of the body accordingly because your knee wasn't,
Yep.
so you're absolutely right. So sometimes it's better, guys, to just take care of the problem when it comes.
It's like somebody with like a knee replacement or a hip replacement, they come in, they're like, I've been having a sciatic pain on the opposite side. I don't know why. And it's just a very common issue. And I'll explain
Yeah.
to them, because it's very painful to put weight on your leg. You just post-op, So they're like, you know what? I never thought about that. But that's what happens.
Yeah. What about knee buckling? That's another thing. As people are getting older and stuff, I hear a lot of that people get scared. Especially elderly get really scared that, oh, my knee buckled once, and then they're just like they don't know what to do.
Well, what happens is that as we get older, we become a little bit more sedentary. We sit on the couch a lot more. We're not exercising as frequently because we just don't want to. And therefore, what happens is that the muscles tend to weaken. You're talking about the entire, lower extremities, the hip muscles that support the hip, the back muscles, your trunk muscles that stabilize your spine. So the same thing with your knee. You have your quadriceps, which are the muscles in the front of your thigh. You have your hamstrings, which are the muscles in your back of your thigh. Those are the muscles predominantly that stabilize your knee. And then you got your ligaments. So sometimes when people buckle and their leg will give out on them, sometimes that's a sign of weakness. It could also be an underlying condition of a cartilage tear, or otherwise known as a meniscus type of injury, which is a very common thing too. I always say physical therapy, number one. And worst case scenarios, they may do a knee arthroscopy, which actually will clean out the knee a little bit. I really don't recommend those, especially if you're older, because I think it just advances arthritis at a faster rate, and eventually you're going to need that knee replacement. So what I always say is physical therapy, number one. If you're really in severe pain, a possible cortisone shot just to kind of take you out, maybe just one injection. And then now, they have gel shots too. They do a series of gel injections to try to lubricate the joint a little bit more. That seems to be working. They also have the plasma injections too, which is very expensive and not covered by insurance. That's like for the stem cells to regrow and rejuvenate the knee. Sometimes that works, sometimes it doesn't. So there are a ton of options out there that you could do, but it all correlates with number one, doing physical therapy in conjunction with everything else.
Okay. What is your take on the knee braces or the ankle braces people can just buy from like CVS or something like that?
Well, we'll start with the knee first. As far as the knee braces, I never recommend anybody bracing unless they have a lot of instability. If your knee is constantly buckling, absolutely you need to brace. If you're in 10 out of 10 pain and can't weight bear on your leg, yes, you should brace. But if you're like 3 or 4 out of 10 pain, I think just bracing, those muscles start to depend on that brace a little too much, and over time they'll weaken even more. As far as the ankle, it's a weight-bearing joint, just like your knee is, but the ankle, you got to stand on your feet, you got to walk, you got to do stairs. So if you have like an acute sprain, which just happened, you have a lot of swelling in your ankle, absolutely, maybe one of those little gel air casts, the blue and green ones that they put on with the Velcro, or just something that you can get over the counter, like a sleeve that you could pull up with the little support on both sides, because usually most common ankle sprains are the outside of the ankle, the lateral malleoli, which they call malleolus, and you get that, a lot of swelling. So that would really help. if it's an acute injury. But if it's something that's chronic and it's something that you can bear with, I wouldn't then recommend bracing after that.
Okay. Okay. Give me some basic exercises if people are starting to either start having hip pain or knee pain. Are there any basic exercises that you think that can start benefiting them, or that's now it's an indicator they need to go and see a PT and find out exactly what's going on and take care of the problem accordingly?
It all depends on the injury and how the patient presents. If you have like a severe knee osteoarthritis, that would be very easy in the beginning. Maybe just doing some what they call quad sets or some heel slides. Just those are the basics, just to get some work on the quad strengthening. Because sometimes what happens is that the quadricep muscles, which are the front thigh muscles, they're not functioning, they're not working, they're not activating. So you want to get them to activate. As far as the heel slides, if they're limited with mobility, if they have a flexor contracture where they can't fully extend their knee or they can't fully bend their knee, maybe a heel slide to work on some range of motion. I also incorporate some stretching for the hamstrings, for the quadriceps, for the calf muscles. I'll do some close chain exercises like some heel raises, up and down to your toes, like a mini wall squat will help out as well. And maybe like a stepping up on a stair,
Yeah.
but not a really high step. A shallow step would be
Shallow
even
stuff. Yeah.
better, and work your way up to a bigger step. And, recumbent bicycle is always a great exercise just to
I
work on
love
as
that.
well. So there's a lot of things that you could do on your own, and you could look up everything I mentioned, and that would kind of help you a little bit just to get you moving.
Yeah. And then guys, if you feel like the issue is not going away or it's getting worse, definitely, then you need to like stop and you need to go see somebody so you can get diagnosed properly. Because like, Rob mentioned in the beginning, a lot of different diagnoses. So a lot of these issues can be coming from different things. And if you pinpoint it, then you can actually get the correct treatment. And then, you get the results are accordingly as well. So that definitely is a big thing. Um, Rob, I wanted you to touch maybe a little bit upon flat feet, because a lot of people have flat feet. What
I'm one of them. I am one of them.
So when you're younger versus in your 30s and 40s versus if you're in your 60s and stuff, what is this the flat feet is going to do to your body, and then what are some of
Well,
the things that we can do for that?
it changes the angles on the joints. I mean, on your hip, on your back, on your knees. So people that have really, really flat feet, you could develop, I'll start with the bottom, Achilles tendonitis, a plantar fasciitis. These are all, just overuse inflammatory issues that are very, very common in the clinic. Medial meniscal problems, because what happens is with flat feet, your knees kind of knock in a little bit like that. And
Good
then you have
coming.
what they call a Q angle, which is increased. Usually in women, it's higher than men. But what I always recommend, and I just took this out of my shoe, an orthotic, okay? This is a simple thing. This is called a power step, okay? And it's really good for people with flat foot conditions. You can purchase this little thing on Amazon for about 25 bucks or so. And I usually get like the very rigid one on the bigger guy. If you were very petite, you could get a softer one. But if you're a bigger guy or a heavier woman, something that's very rigid, it'll help you with the correction of your angles of your knees. It'll take the pressure and the stress off your joints and your back as well. It helps tremendously. So that's what I normally see with flat foot conditions. I treat the issues, but you can treat the issues, get them out of pain, but you have to correct the alignment. So,
Yes.
and I wouldn't recommend going out and spending, I'm sorry, all my podiatrist friends out there, but spending $450 to $500 for a pair of orthotics when you could spend 25 bucks for something like this. And I have them in every pair of my shoes, and they work exceptionally well.
Okay, you're right, because I know when I'm working with the children in school, it's amazing to see when you just correct that flat foot and that comes up, and then everything, ankle, knee, hip, everything starts going to where it is, versus when everything was just like leaning in, and all of a sudden everything starts standing up straight. So it makes a huge difference, definitely, with the walk and everything also. And again, I've seen people who are having back pain because they have flat feet, because obviously they didn't take care of the problem for the longest time, and then
Well, people come into my clinic all the time, and when I assess them, and I'm very thorough with my assessments, and they're coming in for back pain. I'm like, you need to get a pair of orthotics. And they look at me like I'm crazy. And I'm like, trust me, get the orthotics, wear them, and see if it helps you with your back pain, especially people that have standing jobs, your
Yes.
security guards, your doormen, people that are always on their feet, running, whatever, if you're on your feet 8 hours a day, working the mall, whatever, and you're having back pain and you have flat feet, I'm telling you, a little correction like that goes a long way.
And you know what, Ed, there's one little thing people forget. So they'll get the orthotics eventually, and then they'll put it in their shoes that they're wearing outside the house. But if you're home,
Yes.
you should have a pair of orthotics with pair of sneakers that, if you don't like wearing outdoor shoes indoors, have a separate pair of sneakers for home with the orthotics in it that you wear in the house. They're
In the
clean
house.
sneakers, just like your house slippers. So
Oh,
that's one thing, you guys, you need to really invest in and understand the importance of it, because now women are standing in the house cooking or cleaning, and they're like, my back is hurting, but I have the orthotics, but you're
but
only wearing it for like
and then
an hour when you go out. The rest
absolutely.
of the day, you're not wearing them.
And I'm very guilty of that because I do cook a lot too. And when I'm on my feet, I have a big Italian family on Sundays and they're here for dinner and I'm on my feet 3-4 hours cooking dinner in the kitchen. If I'm not wearing my orthotics, my back starts to stiffen up. And then I go inside, like you said, I put my shoes on and I'm telling you right away, you feel a difference.
Yeah, that I am telling you, because I don't know what it is. Sometimes we don't think of those little details, and that's where it makes a difference, right? So now you invested in orthotics, you're like, oh, these work great, but you're not wearing them because in the house you're not using them. So make sure you're making those changes also. Once you get the orthotics and stuff.
Absolutely.
Rob, this was amazing. I like, as always, we learned so much. Is there anything else you would maybe like to tell us, since you see this a lot more in your outpatient clinic, and anything that specifically you wanted to tell the viewers?
Well, if you have a chronic problem that's going on for a long, long time and you're stubborn about it and you turn around and it's, oh, it'll go away. And it's going on 3, 4, 5, 6 months. It's only, first of all, it's not going away. Second of all, it's only going to get worse. So if you're having a knee issue, a hip issue, an ankle issue, I would always say consult your physician first, possibly go for a few x-rays just to check out everything to make sure that there's nothing structurally wrong with you. Secondly, get that prescription for physical therapy, come on in, and we can work with you. As far as any conditions that you have, tendinitises, bursitis, osteoarthritis, anything that correlates with an orthopedic condition, go see your physical therapist and get some treatment at least twice a week, minimal, and you'll feel a lot better about yourself.
You're absolutely right. And like I tell you guys before also, home exercise program is so important, and you'll get that when you go see your PT.
Correct.
When you're leaving, take your home exercise program with you. So once your issue is gone, and then next year you feel like, oh, starting again, you already have the exercise program. So it's something that you can do it for yourself. It's not something that you need to be dependent on. You can you have to learn about your body. You have to see what you need to do, what works, what doesn't work. Get the help of a professional, and then once they help you, then you have the tools with you to take care of that problem long term.
And just don't take that home exercise program. Actually do it.
Yes. That's the other thing.
That's the hard part, because we all, like I say, we all get lazy and we stop doing it.
Yeah.
Make time for yourself. Number one.
Absolutely. There is always 5 minutes for yourself. But that, sometimes we have to allot the time. Actually, Rob, that is one thing I have the hardest time doing, is teaching my patients when to do their home exercise program. Not how, when. Like, I literally have to sit there and spend 15 minutes going through their day and convincing them, okay, over here, you can put in 15 minutes for yourself. It's kind of sad, but you know what? Hopefully, as people get more educated, they'll make that exception for themselves. And, just like we take time out for everything else, take time out for ourselves as well.
That is 100% true.
So thank you so much, Rob, for coming back. I really appreciate it. We learned so much when you covered the other 2 sessions as well. Thank you so much. And you know what? I'm sure I'm going to be having you come back on in the future for more details. There's so much knowledge that you have that we can, benefit from.
All day. Not a problem. Anytime, Fareen.
All right. Thank you so much. All right, guys. Until next time, take care. Bye.
Take care. Bye-bye.